Hi, my name is Dr. Todd Austin from Austin Family Chiropractic in Burden, Illinois. And today I'd like to talk to you about how I use the LumiCare Duo laser for treating a variety of knee pain issues in my chiropractic clinic. And it is one of those units that I use on a daily basis in the clinic at this point. When it comes to treating knee pain as a chiropractor, I have occasion to treat things like bone-on-bone arthritis a lot, as well as medial meniscus issues, anterior cruciate issues, and medial collateral ligament issues as well. Some of these patients I'm treating and we're going to help them avoid surgery altogether. Others patients I'm treating, they are going to need surgery. We're just going to make them more comfortable throughout that process until they can get the surgery with the laser treatments. And then some of those patients, we're also going to laser them post-surgically as well to speed up the recovery. So the way I look at the pre and post-surgical when using the LumiCare laser, the laser light photons have a cumulative effect, is what I want to say. So we are, in essence, preparing that patient to be the best possible specimen in the best shape for the surgeon who's going to do that surgery. So because of that, there's likely going to be less scar tissue and quicker recovery. And then we do the post-surgical laser therapy with the LumiCare as well. And once again, that is going to get, a lot of times, going to get us a quicker recovery from the surgical procedure. So that's what we'll go through some of that in the demonstration part of this video. Okay, so I'm going to demonstrate some common areas that I work with on the knee with the LumiCare Duo laser. So the typical areas we treat are the medial and the inferior knee, and that's where, of course, the unhappy triad of the medial meniscus, medial collateral ligament, and anterior cruciate ligament are located in that medial inferior area of the knee. So those are typically the areas I'm going to work with, but sometimes we'll have a patient where it's like the eyes of the knee right here on either side, just below the patella. Other patients, they'll say like it's a line underneath the patella. Other people, it'll be more up here into the, a little higher in the medial knee. And occasionally I have people that have pain over here in the lateral knee. So for any of the knee issues, I'm going to have the laser on the joint setting. Sometimes I have patients come in and they say almost like drawing a circle around the knee. And so if that was the case, I would just use one head and I would just scan that whole area, for the full 5-minute treatment around the kneecap. Okay, so a lot of times we'll get an issue. I've got a lady I'm working with now. And keep in mind with the knees, sometimes patients will have to have surgery, but this lady is bone on bone on her left medial knee. And so the two areas that we've been working with, she just got an MRI the other day and it confirmed the areas I was working. I have it on joint setting. I'm going to switch to 2 heads. And I'm going to set it up like this. And that's how I've been working with her. She's scheduled for knee replacement surgery in about 7 or 8 weeks. But in the meantime, we're going to continue working with her once a week, lasering here, 5 minutes each time, and that makes her more comfortable as she gets ready to go have the surgery. So that's what we're doing there. So that's a common area that I laser here with the knee, is the one head on more of the inferior, one head more on the medial. I did have one patient we were working with a few months ago. He had the pain here on the outside of the knee, and he also had some on the inferior medial. So we would address that like this. A lot of times we have patients that they'll have some pain on both of the knees, and typically the same area. I've got one lady I'm working with right now. Hers is right here where the medial meets the inferior on both sides. So what I do with her is we just do that on both knees, same spot, and I will just hold that there for the full 5 minutes when I do the laser treatment on her. For a Baker's cyst, since that's really a soft tissue thing, and I'm going to go with the muscle setting because the muscle setting would be not only for muscles but other soft tissues as well, tendons, ligaments. I would be working right in there, and that's how I would do the Baker's cyst. So these are just the common applications that I would use in my clinic when we're working with knee pain patients and using the LumiCare Duo laser. So the LumiCare Duo laser is a great laser unit for treating knee conditions, both to avoid surgery and pre and post surgically as well as in athletes. So I hope you will consider adding the LumiCare Duo laser to the offerings of your clinic. Thank you for watching. Happy lasering and have a terrific day.